So Subhoji, you're here for your eye examination. So do you have any irritation on your eyes?
No, I'm here for a routine checkup.
Okay, so we'll begin your routine checkup by visual acuity. Is that okay?
Yes.
The first important area of examination is visual acuity. For this, we use the Snellen chart.
So now I'll be checking your visual acuity. So the glasses you are wearing, are they just for reading or are they prescribed?
This is prescribed.
Okay, so can you please stand here? Make sure that the distance between the Snellen chart and the patient is 20 feet apart. So can you please hold this for me on your left eye and read the smallest line possible over there.
D E F G T E C.
Okay, can you repeat the same for the right eye?
D E G F G T E C.
The normal person's visual acuity is 20 by 20.
So the patient's visual acuity is 20 by 20.
Here we'll perform the static finger wiggle test and the kinetic red target test.
Now I'll be performing the static wiggle test. Please look into my eyes and I'll wiggle my fingers. Just let me know when you see the wiggling, okay?
Place your hands 2 feet apart out of the patient's view, roughly lateral to the patient's ears.
Yes.
Test each quadrant and each eye individually and record the extent of the visits in each area.
So now I'll be performing the red kinetic target test. So I'll be moving this around your eyes and you should tell me when it first appears red, okay?
Facing the patient, move a 5 mm red dot pin inward from beyond the boundary of each quadrant.
Yes.
Okay. Now I'll be inspecting your eyebrows, your eyelids to see if there is any inflammation or lesions around your eye and also to check for scaliness. Is that okay?
Okay.
Okay, so first we'll start by detecting your eyebrows.
Note their fullness, hair distribution, and any scaliness in the underlying skin.
There is no scaliness around your eyebrows. Now I'm going to inspect your eyelids to check if there is any edema. The color of your eyelids, it is okay, there is no scaliness. Next, can you please close your eyes for me? And can you open? Okay, so there is no presence of lid lag. Now I'm going to check your lacrimal apparatus. Can you please move your eyes upside? There is no excessive tearing or watery eyes. Also, now I'll check the palpebral conjunctiva. The color is normal. Also, there is the sclera is intact. Now we'll check for the iris. So can you look into my eyes? Yes. The iris and the pupil are also intact.
The marking of the iris should be clearly defined. With your shining light directly from the temporal side, look for a crescenting shadow on the medial side of the iris.
There is none. Also, the size of the pupil is in 2 to 5 mm. Sir, now I am going to perform light reaction for your pupillary reactions. So for that, I'll be shining this light in your eyes. Is that okay?
Okay.
Make sure that the room is dark. Also, first we'll be checking for direct reaction. In this, look away. So look away. For this, we'll see the direct reaction of the pupils, which is visible over here. The pupils are constricting on light exposure. Now we are checking for consensual light reaction. So here, on exposure of one eye, both the eyes are constricting. That is our consensual reaction. So the light reactions of my patient are intact. Sir, now I am going to perform near reaction on you. So can you look at the tip of the pencil over my shoulder at the same time?
Yes.
Here we are checking for the pupillary constriction.
Here, the accommodation of lens is not visible.
Pupillary constrictions can be seen. So now I'll be checking for the activity of your extraocular muscles. So please follow my fingertip. Okay?
Make a wide edge in the air and lead the patient's gaze to the patient's extreme right, to the right and upward, down on the right, then without pausing in the middle, to the extreme left, left and upward, and down on the left. Pause during the upward and lateral gaze to detect nystagmus.
So your extraocular muscles are intact.
Darken the room, turn the lens disc to 0 diopter, hold the ophthalmoscope in your right hand and use your right eye to examine the patient's right eye.
Now we'll check for the internal structures of the eye using ophthalmoscope. So for that, first we'll see the intensity. That's okay. First we'll see the eye from distance and then we'll move slowly towards the patient's eye.
Hold the ophthalmoscope with the hand tilted laterally at about 20-degree slants. Place yourself 15 inches away from the patient and at an angle of 15-degree lateral to the patient's line of vision.
Veins are dilated, whereas the arteries are narrower and the optic disc and the macula, they are intact. So that's all for the ophthalmoscopic test. I'm Dr. Khushi and you are?
I'm super excited.
So Subhojit, I see that you are here for an ear examination. So have you had any deformities or difficulty in hearing recently?
No, I'm here for my routine checkup.
So okay, so I'll perform an ear examination on you and we'll see if there is any problem with the ear. So I'm checking your auricle for any lump or lesions, okay?
Okay.
If ear pain, discharge or inflammation is present, move the auricle up and down, press the tragus and press firmly just behind the ear.
Do you feel any pain?
No.
Do you feel any pain?
No.
So there is no problem. Before using the instrument, make sure you sanitize your hands. So now, Mr. Subhojit, I will be placing this otoscope in your ear canal. So please let me know at any point if you feel uncomfortable. Is that okay?
Okay.
So while using the otoscope, make sure that the helix is upward and backward so that you get a better visualization. And move the otoscope downward and forward.
Inspect the ear canal, noting any discharge, foreign bodies or redness of the skin. Inspect the eardrum, note its color and contour. Also, identify the handle of malleus.
So now I'll perform the whispered voice test for your auditory acuity. Is it okay?
Okay.
Stand 2 feet behind the seated patient so that he cannot read your lips.
I'll be placing my finger in your left ear. So first we'll test your auditory acuity for your right ear. Is that okay?
Okay.
Okay. So now I'll repeat. I'll say 3 words. Please repeat them. Okay?
Okay.
Exhale a full breath before whispering to ensure a quiet voice. For patients failing the whispered voice test, the Weber and Rene folk test may help determine if the hearing loss is conductive or sensory neural.
I'll be performing your test for lateralization or the Weber's test. For that, I'll strike this fork and place it on the top of your head. Is that okay?
Okay.
Okay. So here we go. Is the sound audible louder in one ear or the same in both ears?
Same in both ears.
In unilateral conductive hearing loss, sound is heard in the impaired ear.
So now I'll perform your test for air and bone conduction. For that, I'll strike this fork and place it on the back of your ear and also in front of your ear. You should tell me when you hear the sound. Okay?
Okay.
Okay.
Yes.
Make sure that the U of the tuning fork is always forward.
Yes.
Normally, the sound is heard longer through air than through bone.